Hello everyone, I'm Maggie, a dietitian from Changhua Christian Hospital. The topic I would like to share with you today is medical nutritional therapy for diabetes patient. According to the 9th edition of IDF International Diabetes Federation, Diabetes Atlas, there are 463 million people living with diabetes. And this number is still climbing. If we don't take any response to this disease, there will be 700 million people living with diabetes in 2045. Diabetes is a type of chronic disease. To patients, it's considered a silent killer, because most do not show symptoms during the early stage. When a person continues to have high blood sugar levels, the risk of complications increase. Patients with type 2 diabetes may already show acute or chronic diabetes symptoms by the time of diagnosis. Common consequences of diabetes include diabetic foot disease, retinopathy, periodontitis, dental caries, cardiovascular disease, and nephropathy. Without proper treatment, diabetes may lead to disabilities or death. Are there any ways to stop or delay the development of these diseases? According to the guidelines released by the American Diabetes Association (ADA) and the European Association for the Study of Diabetes (EASD), in 2018, all patients with diabetes should be educated on self-managing diabetes and support (DSMES), psychosocial emotional health concerns, and, most importantly, medical nutritional therapy (MNT). For people with diabetes, the most challenging part of the treatment process may be the diet plan. But it is a crucial part of treatment. First, we will discuss the importance of MNT. Next, we will go over specific recommendations in the MNT diet plan. Lastly, we will discuss the benefits patients receive after MNT. In the most important part, we know that metformin is the first-line oral medication recommended for glycemic control in patients with type 2 diabetes. Taking metformin can lower HbA1c by 1.12%. But recently, there have been more studies showing that medical nutritional therapy can help patients control their blood sugar levels. The results have also been proven to be better than taking metformin. Patients with type 1 diabetes have shown a decrease in A1C of 1.0 to 1.9%. Patients with type 2 diabetes have shown a decrease in A1C of 0.3 to 2.0%. As the ADA stated, medical nutrition therapy is an important part of the fundamental management plan. The treatment guidelines mentions first-line therapy is metformin and lifestyle. The management algorithm of the American Association of Clinical Endocrinology and American College of Endocrinology also mentions that lifestyle adjustments should be made first. Lifestyle therapy also emphasizes nutritional intervention as most important. Similarly, the Canadian Diabetes Association 2018 guidelines also mentions that all patients need to receive nutritional therapy regardless of how they control their blood sugar levels. One-size-fits-all eating plan is not evident for the prevention or management of diabetes. Using the patient's cultural background, personal preferences, family medical history, and socioeconomic status, a dietitian will create a suitable and achievable treatment plan with the patient. In Taiwan, patients receive medical nutrition therapy when they are first diagnosed with diabetes, then once every 3 months. The first step of nutritional assessment is to take anthropometric measurement, which include measuring the patient's height, weight, waist circumference, cortical thickness, and body composition. Next is the biochemical analysis, which analyzes the patient's blood sugar, blood lipids, vitamins, and minerals. Following that is the clinical examination. Lastly, the dietary assessment, which evaluates the patient's dietary intake, habits, and nutrient intake, is completed. Nutritional intervention is the second step. Through education and consultation, Nutritional intervention can promote suitable diet plans, improve the patient's weight, and help the patient live a healthier lifestyle. We will mainly discuss how to implement a diet plan. A dietitian will create a suitable and achievable treatment plan with the patient. This plan is individualized and allows patients to pick healthy foods that meet their personal needs, while optimizing their overall health. At the beginning of creating a plan, the dietitian must inform the patient of the foods that affect their blood sugar level. Using food classifications, the foods that affect blood sugar levels include staple, legume, fruit, and milk. The foods that do not affect blood sugar levels include protein, vegetables, oil, and nuts. The next step is to inform the patient of the amount they can eat. According to the ADA guidelines, there is currently no optimal ratio of the big three macronutrients. However, it should be adjusted individually based on the patient's condition. Some studies have shown that the nutrient intake for diabetic patients is the same as that of the general public. About 45% of calories come from carbohydrates, 36% to 40% from fats, and 16% to 18% from protein. The goal of the diet plan is to achieve weight control through energy balance, because past studies have shown that overweight diabetic patients who lose 5% of their weight can help control their blood sugar levels and reduce the possibility of drug use. Lastly, patients can choose a healthy diet using literature, which includes many healthy diets beneficial for diabetic patients. Mediterranean diet emphasizes plant-based food, fish, and other seafood. Olive oil is the principal source of dietary fat, and dairy products are eaten in low to moderate amounts. Vegetarian diet emphasizes plant-based food devoid of all flesh foods. Vegan diet is also devoid of animal-derived products, which vegetarian diet includes. The diets can reduce the risk of diabetes and reduce glycated hemoglobin. Diet emphasizes vegetables, fruits, and low-fat dairy products. It includes whole intact grains, poultry, and nuts, as well as a decrease in intake of saturated fat, red meat, sweets, and sugar-containing beverages. Occasionally, sodium intake is also reduced. Low-fat diet is defined as a total fat intake of 30% or less of total calories and saturated fat intake of 10% or less. It emphasizes vegetables, fruits, starches, lean protein sources, and low-fat dairy products. It can lower the risk of diabetes. Low-carb diet is defined as reducing carbohydrates to 26% to 45% of total calories. It avoids starchy and sugary foods, like pasta, rice, potatoes, bread, and sweets. Some plans include fruit and a greater array of non-starchy vegetables. Very low-carb diet is defined as reducing carbohydrates to less than 26% of total calories. Meals typically derive more than half of calories from fat. Regardless of which diet is chosen, calorie intake control is very important. What benefits can patients receive after going through medical nutrition therapy? To promote and support healthy eating patterns, emphasizing a variety of nutrient-dense foods in appropriate portion sizes. To improve overall health and attain individualized glycemic, blood pressure, and lipid goals. Next, medical nutrition therapy can also help patients maintain an ideal weight. When the patient's blood sugar level, blood pressure, blood lipids, and weight are maintained well, it can prevent or delay health complications. To the patient, it can also improve overall health and quality life. To medical personnel, it can also reduce medical costs. While working towards blood sugar level control, let us continue to work hard with patients. Thank you to everyone for listening.